Assalamu alaikum wa rahmatullahi wa barakatuh. Very good day to you and welcome to this edition of Pregnancy to Parenting. I'm Khawa Solomon. Shukran so much for joining us as we look at the second season, almost the ending of our second season. You've been part of the time since we've met, hubby, to falling pregnant, the fertility, the sexual courtesy within a marriage, the different stages of pregnancy. Dr. Malika van der Skeef was part of that, and looking at the ward that you're going to be in, whether you are giving birth in the private, public, or even at home. And those are all the aspects we looked at within the first season, as well as touching it on the second season when baby is born, alhamdulillah. So you've been part of it, and now we're going through the journey of baby being born, breastfeeding. We also want to highlight an important event that happened over the past few weeks, which was the 16 days of activism against women and children. We'll be looking at teenage pregnancies and also parenting at that stage. So stay with us in the next few weeks as we look at exciting shows when taking baby home as well, and very importantly breastfeeding. With me once again is Sister Fawzia Samuels. Sister Fawzia is specializing in midwifery and has a speciality in advanced midwifery rather, and she's heading the midwives out at Al Nisa maternity home, who we profiled not too long ago. So let's welcome Sister Fawzia back again. Assalamu alaikum, Sister Fawzia.
Walaikum salam wa rahmatullahi wa barakatuh.
Shukran so much for joining us once again. This is a very busy time of the year, so we really appreciate you taking time out to discuss with us on this topic. Now, we're looking at what happens at birth. This beautiful procedure, happy, everybody's, a height of emotions, and this precious newborn is exactly what we're looking at the time of birth. So mommy is now in labor, and we looked at birth plan and getting ready for labor, but now baby is crowning, where the baby will be pushed out, where the baby will be taken out. These are one of the things that is happening during birth. But mom is anxious, she's also very nervous and exhausted as well in many cases, and not too sure what is really happening at that time of birth. So please explain to us, once baby is popped out and hopefully pushed out with no sort of complications, and also there's a cesarean where baby is taken out in theatre, what exactly is happening during that time, the checks and important balances when baby is now received into this world?
Yeah, it is like you say, the mom at that time is very exhausted. It has been, say, just close to 10 and a little more hours after she's gone through her first stage. And specifically at the time where she is, the midwife assessed her and found her to be ready for delivery. There is that little bit of a time where the contractions sort of slow down and it almost stops. And we call it the lull phase, where baby prepares, but also for the mom. And that is the time that the anxiousness comes.
Yes.
Because you wonder, would I be able to really do this extra? And what I normally do is I tell them, it's like running the comrade. Now it's just a downhill little bit. So you've come all that way now, and to miss out on your medal, it's not worth it. So you try a little bit, encourage them in a psychological way, and then just for that very last minute, allow them all that just to rest a little bit and then to carry forward.
I remember the lull stage, because I was thinking during the birth, oh my goodness, what's happening now? Is the big bang now finally happening? Because there's just this stillness. And at that time, beautifully the midwives do, and the support staff, alhamdulillah, do actually.
All you can basically do is just to wait it out. I always tell them that there is a time for us to come. So we are prepared for that last few seconds
it's not
coming.
Long.
But it seems like it's long because you want it to be finished, because you are scared, you've had all this pain, all those things. Once we see that period is gone, the contractions normally comes very strongly, and then you see the crowning, and then alhamdulillah the baby is born. Immediately after the baby is born, the midwife does the 1-minute assessment. It's called the APGAR score. And that is to assess how the baby has gone through the journey, whether it's breathing, whether the heart rate is fine, the color of the baby is so very important. If it's not pink, then you know that the perfusion is not right, something is wrong. You listen to the cry, because if it comes blue, then you know that the circulation is not good. It's either that it's a breathing problem or the heart. And then you check the crying. Is it a vigorous cry? Is it attempt to cry? Can it not cry? Is it something that's happening? And you look at how active the baby is. So that is the first thing that you do at 1 minute when it comes out. And it's so very important because that, that first few seconds when you see the little one, you have to, as the midwife, have to observe all these things and then make a decision. Can I put it now onto the chest and you know, or does I need to resuscitate this little one?
So within that 60 seconds, the breath that the mom's just basically gasping now after she's did the final push, the midwife or the support staff in the theatre is now has the baby to check within that 60 seconds, and that decision is now made. Do we do the kangaroo quickly, let mom and the baby feel each other, or do we need to take further action?
And there is people with birth plans, and that is where it comes in. Once again, you as the midwife have to prepare your client for these things that might possibly happen, so that you, at the end of the day, you don't feel like your birth experience wasn't what it should be. But it's because of those little things that we can never predict. So if the baby comes out, it's fine. Your APGAR score after 1 minute is 9. It's a healthy baby. It's crying very well. It's pink. Then, alhamdulillah, you would give it to the mom and you would start that bonding immediately. Because after all that pain and everything, I think each and every woman, the only thing that you can then would want to do is just to hold your baby and see it. But then once again, also we must just not assume, and we mustn't do what we think it's wrong, because not a lot of ladies can take the baby onto their chest. So once again, you as a midwife would find out if it is okay with the person. And then of course the bonding, and once the baby is with the mom, the heart rate is normalized, the cord has pulsated enough blood through, then of course you would go on to the clamping of your cord and then separate the baby from the mom. And normally you would ask the father, if he is present, or whoever is present, the birth partner, if they would want to. And normally your client would tell you who is the person that would cut the cord, and you would prepare that then. And then after that, if the baby is now being cut the cord, a little bit more bonding, then you can go on, because your baby is fine. You would go on then and do the full examination of the baby, which is also very important.
So I didn't quite know that the cutting of the cord with mom being so exhausted on the other side. I had that few minutes to bond, because and I didn't even realize that all of that was protocol, you know, asking mom,
yes, it is.
Do you want to hold baby? Because I thought when they gave my babies to me and they asked me, it was just it was like, of course I want to hold my baby. But what happens in the cases when, you know, the mom feels a bit distant to not wanting to hold the baby?
A lot of the moms are very young and they are overwhelmed. They haven't been prepared. So then you have your birth partner. Would they want to take the baby? And normally the birth assistant from you as a midwife is more than welcome just to take it and play it a little bit. Or otherwise you could do your examination, just so that you don't make the mom feel that it's something that she's doing wrong. Yes, we all have, we have as women the ability to have children, but the instinct sometimes is a little bit delayed. So we have to respect that and not make her feel, you know, not be judgmental around the whole thing.
Appreciative, not even realizing that it is happening. That's great. Alhamdulillah, so glad to hear that. Motherly ways of and so empathetic ways of dealing with it. Alhamdulillah. So looking at now, mommy has held the baby. I'm sure she wants to just hold the baby all the time. That's how I felt. And now you have to do a proper balance and check with baby, because after baby is born, that 60 seconds is the crying, it's the breathing,
it's
and the cord is
how responsive the baby is,
how responsive the
color
baby
of
is.
the baby.
And of course the cord is still on. So when baby is on mommy, the cord is still on. And the reason for the cord being on, because I know often when babies are born, and I don't know if that has changed, but you would first see, sometimes even before they give the baby to mommy, maybe I speak under correction, that the cord would then be clamped and cut even.
There is a new trend that we have delayed cord clamping. And that is because they feel that the last bit of blood flow from the mom to the baby.
Okay.
It helps the baby not being anemic,
Right.
So you get the last few bits of red blood cells together with the blood flow to the baby. But that takes about 2 minutes.
Yeah.
So normally, or if you look at it at what was done before and now, it's amount to the same thing, because you would take your baby out, put it down, start rubbing it, and in that case, not even clamp first. That 2 minutes would have elapsed. But now we make sure that we put the baby onto the chest, and then wait for that 2 minutes, and then clamp the cord.
So that's the new procedure. On mommy, baby comes out. Just find out mommy wants a baby, on mommy, and then that few minutes before
and then
the clamping.
we would then ask, and in that time you will see the bleeding, whatever's happening, whether the mom needs to put the legs down. It gives you a time then to prepare also. Get your towels, whatever ready, because you have to dry baby inevitably. You have to, once she's bonded, that little bit of time.
Wow, it's such a beautiful event, and definitely one could feel that the Almighty is at play here in every way, no matter how things have turned out. Just before we go on to the next procedures and important checks or even immunizations, just from your side, and before we take our next ad break, on your side, what is it like to be there and to see that the start of creation day after day, in so many years you've been in the industry?
I think from the first baby that I delivered, you know that you are part of something that you cannot explain and describe to people. Especially in the lull phase, that there is a presence surrounding you that makes you feel that how insignificant we are as people with all our achievements, with everything that we have. That when it comes to that part of the time when a baby is born, that there is a greater being out there who is all powerful and in control. So that is the most wonderful, it's the most beautiful experience. When the baby comes out, it is a child, it's got a heart rate, everything. But when the baby takes the first breath, there is something that you always feel amazed. I always feel amazed when I looked at it, and I try and focus on that when it happens. And then just when you put the baby into the mom's arms, I always tell them, does it look familiar? Does the baby look familiar? Then they say yes, because I say it is. It looks like somebody you've known all your life. Not that like it's the first time that you've seen this person. Yes.
Wow, mashallah, that's a new way of looking at. I've never heard that one. Shukran, Sister Fawzia. We're chatting to Sister Fawzia Samuels as we look at the newborn at birth. We continue with more after the short break, so stay with us. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Pregnancy to Parenting. I'm Hawa Solomon. We not yet halfway through when baby's born, and what an absolute moment of awe to be there at that time. And Sister Fawzia has had the pleasure so many times, and not even realizing the one bit just before baby comes, that few seconds, that lull where pain just stops. I remember it now vividly after giving birth to my kids, alhamdulillah. So I hope that this show will definitely enhance your knowledge and appreciation for those that have given birth, alhamdulillah. Sister Fawzia, welcome back. Let's now look at those balances and checks and any immunizations that happens at that birth. So baby is now, mom is now appreciated the baby there for a few minutes, cord is clamped. We explained the procedure of just delaying it a little bit because of the better blood that now going through, which will help with anemia later on. So now baby is then checked with mommy. Okay, mommy, you now need to just rest a little. We're going to take baby here. So what is explained now to mommy?
We explained to them that we would like them to have it for an hour, but the things that we do in the labor wards though would be that we would clear if there's any secretions and so forth. that are still there with the birth. It is squeezed out when the baby is born, sort of the whole process. But sometimes there is, and that could interfere with the breathing.
Okay.
So we check whether all that is done. We also then administer the vitamin K.
Okay. So what is that?
People, it's a clotting factor that we give. The baby is born without a clotting factor.
Okay.
So we give a little bit so that the baby can have at least. Sometimes the baby, you will say a minute after birth, 5 minutes, and then 10 minutes. But also your baby goes into the ward, so later on there might be complications. And then if you need to do procedures that are invasive, then the baby doesn't have any clotting, then the baby might burn or bleed. So we give the baby that.
So is it a vitamin K drop?
It's a vitamin K drop, or it could be an injection. Okay. It depends then on the facility what they have available, but the baby has that. They also clear out the eyes and they administer the cladomycin. That is just eye prophylaxis because the baby has come through the birth canal.
Okay.
So in case there might be anything that could cause the baby to have an irritation, we give that. And then, of course, you do the weighing, and most mothers are, and whoever is present at birth is always eager to know how much did the baby weigh.
Yeah.
Even the relatives that phone in, they will ask, is it a girl or a boy, and how much did it weigh? Yeah. So we weigh the baby, we measure, we see how tall it is, and then the head circumference. Okay. And then by that time, you have done your full newborn examination, where you examine all the systems, different systems. You note everything that is abnormal because that needs to be checked again. And then after that, generally when everything is done, the cord is now being clamped, you make sure that it's clean, everything, and then the baby would come back to the mom. Okay. So those are the general things that we check in the labor wards.
And that will take about how long?
It takes about a few minutes, 5 or so minutes. If everything is nearby, it doesn't have to be very long. And then, of course, you carry on with your skin to skin, which is so important. Yeah.
So I think everybody's delight happens when baby is now finally born and the baby's there. The support staff that's in the ward hears baby cry, and this very dramatic and the classical scene that's often dramatized on movies where they slap the baby on the bum and the baby cries. Does that really happen for those that don't quite know what's happening? Because does baby usually come out with a cry? How important is that cry as well?
I think it probably happens when we were born.
Okay.
But when I did my training, that was 88.
So when Sister
I
Persia
never
was
saw
born?
it. Yeah, that was probably a practice when I was born.
Okay.
I think I got a good slap. But it's not a practice that I've seen when I did my training.
Right.
I think the transition from the temperature inside of the body to outside is normally at room temperature.
Okay.
So that is enough to make the baby take that first gasp. Just the colder air, but it's not something that it's done. We don't need to keep them upside down and slap them vigorously. No, it's something, I think it's instinct, the circulation takes over. The cord is now being clamped and everything, so the circulation takes over and the baby will breathe on its own.
Okay.
Something that we forgot to mention then just before was with all this testing and whatever, the first thing that you would want to do is to latch your baby to see if it can feed, because now the baby is completely independent of the mom and the afterbirth. So now baby has to now fend for its own food, and we need to see whether the baby has that
so
sucking reflex.
Does that happen when the cord is clamped, or when the baby goes onto mommy, or after the checks? When in between does that happen?
Like once again, you have to assess. If everything is okay and it's okay with the mom, you put the baby on and you latch the baby while you still have to clamp and all those things. Yeah. So we would want to do it immediately. But it has to be with the mom's permission. It has to be something that the mom is comfortable with, and we should just not enforce that. That it is a new trend and we must do it, because once you find out from the mom's antenatally, there's a lot of people that are not ready for all that, or they would like to see what the birth process is going to be like before they can make that decision.
Or some is even in the process, the slow to process that I just gave birth now.
Yeah,
and this
I'm
is
tired.
My baby. I'm tired.
Yes.
Gosh. Something that I would like to ask though is when baby comes out, and you mentioned about the eyes, so just some interesting facts around that. Is baby able to see immediately when baby comes out, or are the eyes meant to be open immediately when baby comes out? Because of course when baby's in incubator in mommy's womb, I'm sure the baby's eyes are closed, so the first opening would be when baby comes out.
No, sometimes you if you take the more advanced imaging now of the babies, you can see that it's open.
Okay.
But and the baby, once it comes out, it can see actually, but not focus.
Yes.
So that would happen at 6 weeks, and that is one of the developmental screenings that we do. We ask, does the baby smile? Because now it can actually focus, and it will mimic back your expression to the baby. Yeah. So they do see, but it's imaging, and it's not a focus thing. And some of them, when they are born, the eyes is closed because it's puffy and swollen. But you will see a few hours later it opens. Yeah.
And I know that the birth of the baby, it's beautifully boucheed, and it makes one just look forward to it. And as you said earlier on, it's not always as pretty as what your birth plan should and want, that you ideally want it to look. So you have to be ready for sometimes a very dirty, messy baby that comes out. So that reality I'd just like you to speak a few minutes on, inshallah.
I feel that our young mommies, they are very young, and they are not prepared for all these things. So from your own family, if I can think about myself, we were not prepared. It's something my mom just shied away from, and I was fortunate that I had this training, but still I was not prepared, but and now they resort to the media and to magazines and to books and to movies and whatever, and that is where they build up these high expectations. And it has to be, it's something that they plan, but like everything that we plan in life, there is that element of failure where it's not going to turn out the way you plan it. Somebody else is in control. And I think once that happens and it doesn't work out that way, people become very disappointed in the whole thing. So we have to be prepared for that element of powerlessness where we are not in control. So your baby might come out and it might not cry at 1 minute. It might not be pink. It might not be responding very well, and your baby have to be resuscitated. Then you have to know that it's something that must happen. You see, the other thing is also that your birth process, it cannot be like all the actresses,
celebrities.
It can't be. I always tell them, just remember those ladies they get paid in dollars. For that whole thing. You're not going to get paid in dollars, but what you're going to get is this beautiful baby. I think we must emphasize to our young moms that at the end of the pregnancy, at the end of the 9 months, there is this beautiful baby coming. And if we focus on that, then you forget everything else. I remember I was looking at my younger daughter, she's 17 now, and I was looking at her the other day, and it was a very horrendous pregnancy because I had all these problems. And I cannot remember, I was in hospital for very long before I had her, and they asked me, what was the food like, Mommy? I said, I don't know. What was the bed like? I don't know. I don't know anything. The only thing I remember was seeing that baby. That was the only thing. Yes, that was the only thing. So I think that we should have our focus on what we want to achieve after this pregnancy. It is to have this beautiful baby coming, but it's you have created it sort of in your way. You facilitated the whole process of this child coming onto the dunya.
Alhamdulillah. And shukr to Allah for giving all moms the necessary energy and the ability to do that. So, and shukran for midwives as yourself to walk us through that journey. So after baby has now done hopefully the breastfeeding skin to skin, and hopefully the almost latch on with mom's permission, the checks and balances are now done. Just quickly run through, when baby is away from mommy now, you are checking, are you using any special instruments? There's just the vitamin K.
Vitamin K drops that we give. It can either be a drop or it could be an injection. Then you have the instruments that are basically, there's just your scale, the suction unit if you do need to suction.
Alright.
The overheat resuscitator if you need to warm it up, or the incubator if the baby's maybe cold and you need to warm it up. And then the measuring tape is just to measure the length and the head circumference of the baby. Those are basically the instruments that we have in the labor ward.
Is there a special light sometimes that they put the baby under? Because I know they move the baby just to another bed, but then is that light there for a reason, or just to watch, just to see?
No, that light is actually it's an open resuscitator. It's like an incubator, but it's open. So that light helps with you as the midwife being able to see everything that you need to do, but it also heats up a little bit.
Shukran so much enlightening us just a little bit of what's happening in the delivery room, because at that moment mom doesn't even know where and what's going on with her baby. So it's important just to recover a little bit, inshallah, concentrate on yourself and gaining your strength back to find before finding focus again on this beautiful newborn. Stay with us as we look at the newborn at birth in this edition of Pregnancy to Parenting. More after this. Assalamu alaikum wa rahmatullahi wa barakatuh. Good day. I hope you are well wherever you find yourselves. We're focusing today on Pregnancy to Parenting, on the newborn at birth. What's actually happening with baby when baby is born at that very minute. That first few seconds are absolutely important, as Sister Fozia Samuels has mentioned to us. That first 60 seconds and the checks that they have to do, where the baby now needs to go back to mommy, or for that very important skin on skin, or where the baby needs further checks in the nursery. We will be delving onto what the role of mommy and daddy is also at that time, and talking to us about the nursery, what happens in the nursery, who is at the nursery, because often you feel so far and distant with your baby. Where they're taking my baby? So just to explain to us a little bit more and get into detail with the nursery quickly, Sister Fozia, because now often baby has now the checks and balances. There's the important aspects that was looked at, and baby's all good and okay. Mommy's now going to maybe just go and wash herself, dress her, or whoever's taking care of mommy now, and baby needs to also go off to nursery often. Just explain to us what happens to baby now in nursery, because baby's just been born and they're going to be washing, clothing baby there now. What's happening?
The baby is, like I said, some babies are with their mom throughout to stay while they are in hospital, and that is the rooming in and the kangaroo care and the skin to skin. But some of our babies are not so fortunate, so those are the babies that need care. So those babies would be taken away from the mom after giving that little bit of time and bonding, and the mom just to see the baby, so they would go to the nursery. The nursery is the facility where they look mainly after little ones, the newborns, the neonates as they are called. And in the nursery you have like the person in charge, and that is a nurse with pediatrics and neonatology. And you have your pediatricians, the neonatologists. They would be in the nursery. And your nursery has different departments. You would have your intensive care for your very sick baby.
So the ICU.
Then, your ICU. Then your step down facility would be your high care. It's those ones that have now recovered sufficiently and progressed to high care, but still need out of the ICU with all those pumps and all those monitors and everything, and then they have now increased, the condition has increased and improved, so they would go to your high care facility, which is also close monitoring, but without maybe being under ventilators and so forth. And then you would have the where they are just observed in the observation area, and those ones would be ready for discharge a few days once they're stable and ready for discharge. So in your nursery, like I said, you have your pediatricians and neonatologists together with your pediatric trained nurses. You would have the sisters, and then you would have your different other categories like your nursing assistants and so forth. But they have all been specializing in neonatology and pediatrics. So once your baby is there, it's very difficult because the mom and dad is given times that they can come and see your little one. So you're completely separated from your little one. So you would go feeding time and visiting times and so forth. And it's a clinical area, so you have to sometimes scrub up and you have to wear a mask and so forth, which is scary to the patient. So the important thing there is that you always inform them about the condition, about why certain procedures are done, and those are sick babies actually, and for the parent it's very traumatic to see them being sick like that. Then also you have the baby that were born very small, and then after now gone through the whole process of the ICU, high care, and your observations, they go now into kangaroo care, where the baby is now completely well, but just growing. So it would be nursed into the mommy's clothing or the dad, and that is where the mom is rooming in.
Is that the really tiny babies?
Those are the very small ones, and it's
the
not
babies?
necessarily just prems, but the ones that were also born small for dates because of various medical conditions. Then you have the facilities where I work and other facilities where the mom has the rooming in, the baby stays with her. So from the labor ward, after she's bonded that hour skin to skin, then mom is taken to the back where she's offered the bath and so forth, but the baby stays with her constantly. It's next to her. Some facilities don't even have the cot. Your baby is nursed in the bed with you, so that you can just keep on promoting and encouraging the bonding, you know.
Now, with regards to baby going into nursery, and I know we're delving a little bit into neonatal care, which we have done previously in the show, but just to quickly delve into that bond between mom and baby, those first few hours of baby now not having that contact with mom and mom being ready to be with baby, and also the breastfeeding, for instance. Just give us some sort of examples how the bonding is kind of remedied, you know, while baby is still there, because baby is in an incubator, of course, so you could only basically put in your hands. So talk to us about that bonding at those sort of instances, and also the breast milk.
The moms are encouraged to express the breast milk. Those ones on the pumps would get express breast milk if they can. Otherwise they would be fed with intravenous fluids. And the mom is encouraged to come in and touch and sit with the baby if her condition allows, because in most cases where there is a sick baby, there's also a mom that had a condition that caused it. So if the mom is fine, if she has sufficiently recovered, they are encouraged to be with the baby most of the time, and the dads are allowed also. In those very high risk areas like those big hospitals, they have certain times where the dad and maybe other siblings can also come, so that enough people bond with the baby. It's a very stressful time to have a very sick baby like that, because you are never sure what the outcome is going to be. So continual bonding is encouraged with them.
So you've mentioned dad in there as well. Talk to us about the role of dad from the time baby is born. You've mentioned quite a few roles that dad could take place when mom is not ready for baby, or just to be part of the whole birthing process. Talk to us about dad's role.
It's a very welcoming thing to see in the labor wards nowadays, and we have a very diverse community in South Africa, and we have a lot of cultures and traditions and religions being practiced, and it's just very welcoming to see that people do try. And once they're in the labor ward and the mom is not in a position then, that we do encourage the father to take the baby and bond with his baby. I've worked in facilities where they even encourage skin to skin with the baby. It's something we have to get around. Once again, you have to know your client and the partner and know what is comfortable for them. So you would not just take a baby and say, put it in your sweater or so. You don't know how the father would react to that. And when it is a newborn, I have seen that a lot of men are very uncomfortable around this little, this little wriggly thing.
Baby,
so you would encourage. Most of the time, you would encourage all that, and even while they're breastfeeding, you know that they are there just for support, and that bond, because the man sort of feels very sort of not involved with the whole thing. You carrying the baby, everyone is around you. You come to antenatal clinic. I always look at them, Shaman, and I ask, and how are you? And they get a shock when you ask, because nobody asks them. They are just there. So by the way, but I feel it's something that we as midwives that we should encourage. We should not force, but we should encourage.
So the fathers are there everywhere.
They are part, yes.
Okay, so taking baby home, what are the focus areas that must be checked with mom and dad, and also with baby specifically before discharging little one? So baby is good. I think there's a 24-hour, 48-hour run for normal delivery, and just a few days if it's cesarean. So now baby's ready to go home. What are the sort of checks that need to be discussed?
In a low-risk facility like ours, baby is your mom's recovery time is like 12 to 24 hours. So in that time before the baby is discharged, what you have to look at is the first thing, the very important thing is whether the baby is feeding. Is the baby healthy after it's been born? The baby must have passed at least urine, and meconium is the first stools that they pass for the first few days. It's almost black in color and very sticky. So you would want that the baby would have emptied the colon of that, because that was accumulating for the whole time it was in utero. So at least if you know that those things are in place, then that's fine. Baby must breathe well. You must be happy with his vital signs. There's nothing wrong with his heart. His breathing is normal and uncomplicated. That for the baby then. But like I said, the most important thing is the feeding. Is it able to feed on its own? For the mom, you would also look at the vital signs, whether she has now recovered enough, everything is okay, she doesn't have an underlying medical condition now. And in her case, it's the bleeding. That would be the most important thing that you would check. You also have to teach her how to identify if there is a problem, like with sepsis, if she's not feeling well, if she's feeling feverish, if she's bleeding too much, those type of things. Those are the type of education that you would give her. But in the mom's case, also whether she has been passing urine, and whether she's able to pass also stool, whether she's able to walk, because we don't know. Sometimes there is a lot of trauma, right? So whether they have any complaints, any backaches, any pains on walking and so forth, you have to check whether all those things are normal before you can discharge her. Yes.
Okay, let's talk about the Road to Health, the clinic card, or better known as the clinic card. We'll talk about that just after the short break. Stay with us as we're discussing baby, our newborn baby at birth. We looked at the actual birth, the bonding, the kangaroo care, checks and balances, and even in some immunizations taking place at birth. But more importantly, this Road to Health card, which is like an ID book for the baby. We'll talk on that just after the short break. So stay with us. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back in our last segment as we're looking at the birth of the newborn, taking baby home. Just a few hours, it was born, and alhamdulillah, you see this beautiful, healthy baby. That's all we want, with 10 fingers and 10 toes, wanting to depart to our new home, at least to baby's new home, taking baby home with the baby bag, all this excitement, wanting to see all this newborn. But there's checks and balances and little bits of procedures that needs to happen, and there are some common areas of concern when our baby is born as well. And before we do move on to our clinic card, which was commonly known as, there is now the Road to Health Baby, Well Baby card. Sister Fozia Samuels is with me in studio, head of the midwives at Al Nisa Maternity Home based here in Cape Town, who has had the privilege to birth, at least to see birthing so many newborns. So inshallah we'll talk more on the Road to Health clinic card. But Sister Fozia, before we do that, what are the common areas of concern when baby is born, like you hear of the jaundice, I think it's called yellow jaundice, when the baby needs special light? What happens in those cases where baby is well, they're okay to go home, and there are just certain areas that we need to look at, like you said, when baby's discharged and when mom's discharged, there's certain checks that needs to happen and information that mom and dad needs to be made aware of. What happens in that case? I know yellow jaundice is quite common sometimes.
They are being checked. The infants are checked with certain blood groups.
Okay.
And certain demographics from where they are coming from. But mainly in South Africa they check the O positive, the babies of the O positive mom, because they have a tendency of developing jaundice. So that is checked 6 hours post delivery.
Okay.
If you had a baby that was sort of bigger than
usual,
more than 4 kilograms, they also check the glucose of the baby 3 hourly. And if it's a low birth weight baby or less than 2 kilograms, then they would also check that.
Okay.
So the baby, if it is found to have jaundice after 6 hours, would then be admitted into the phototherapy unit, where they would have phototherapy for as long as it takes to resolve the jaundice.
Okay. You get these little interesting midwife advices of the saffron water and giving baby this and that. What is your take on those?
Yeah, I think it's a very famous home remedy.
Yeah.
I always used to ask my granny, what do you use the saffron for? And she says it's to make the acne or the biryani little yellow. So I don't know where that came in.
So it's
but
like
it was
almost like the
yes,
homeopathic route.
Yeah. So it's something that we discourage because we don't know what it does.
Okay.
I mean, if it's supposed to make something yellow, and now you're having a yellow baby, it could make it. I don't know if it could make it more yellow. Yeah. But we don't say that it's a wrong practice, but we just educate them around that
what
it's only
now,
the lights that can resolve the jaundice.
Okay.
Yeah.
So mom and baby is finally being discharged, leaving with the car seat and the baby bag, ready to present to the rest of the family. Alhamdulillah. Now comes, in addition to the to having the baby bag, is this Road to Health card that must be in the bag. Talk to us through the Road to Health card. And I brought
two. It's you get it. The greener one is for the male child, and the pink one is for the baby. And this is the ID books
for the baby, the girl, the pink one.
It's the pink one and the male child.
And it says on there girls.
Yeah. It says girls and boys.
And before there was one standard one, eh?
Yeah, we used to have the old one. It's like folded in consent in a way. Yeah, it's a yellow card, and then there was a pink card before that, and I had sort of a blue card. Okay. So the Road to Health booklet is this is the baby's history from even pregnancy, if there was any complications, right through. It's a sort of a reference book, and it can be used all over. You can take your baby's booklet with you and visit wherever you're going, because it tells the history of the baby from birth until where the baby is. And it's got a lot of information as well for the mom about feeding and so forth. And it's got the immunizing scheduling on here. It also does all the milestones, the assessments for the baby. So so all those things would be in here, the blood group of the mom and the history of the mom, everything. And this is a very important card that we must not lose, this card. It's given out by the Department of Health, and it's got its own number inside, so the number's linked to your baby in the delivery book. So if it's lost, you have quite a difficulty in getting a new one, because people are telling you about this card. And this one is the most important thing, because this it shows you as a parent or whoever the growth of the baby, whether it has been normal or whether whether the baby is faltering or whether the baby is growing too big.
Because there are the lines as guides.
Yes, the guides will tell you. The green one is the average one, where it will tell you that your baby is growing averagely.
Okay.
Yeah. So this is the very important one. And then just once again, at the back of the booklet also, it gives to the parents, it tells them when to seek medical attention for the baby.
Okay.
It's got little tips and hints inside on certain conditions, and one is like the diarrhea one.
Yes.
It teaches them how to make the rescue fluids, the ORS for the baby if it has diarrhea. So it's quite an informative booklet, and this thing, the baby needs this booklet until 12 years old, because at 12 years old is the last immunizing that we do. Yeah.
So the book of life, literally, before is just important as the birth certificate of the baby.
Yes.
But I think it's a little bit more, because I think that can still be replaced, but this definitely can't.
Be replaced,
so really look after the road to health. I know, unfortunately, my daughter, we had a theft and her baby bag was stolen. I don't know what they did with her baby stuff, and in there was the clinic cards. Unfortunately, my eldest daughter, who's now 17, does not present a clinic card if anybody ever looks for it. So alhamdulillah, she's at the stage where she gets her ID now, so I'm so glad. But that is definitely a book that one needs to look after, like your ID book. So that can't be replaced. Shukran, Sister Fawzia, for presenting that. Now, looking at certain issues within the last few days when baby are born, we've got 3 minutes left just to cram all of this information. So first is when a baby boy is born, what comes up is circumcisions. Any information that we need to be enlightened on when it comes to circumcisions for little ones?
I think it's advisable that we do it as early as possible. Okay, because the healing process is so much quicker. And the most important thing when your baby has been circumcised is the hygiene. It's just to keep it very clean. Okay, and to recognize when there is maybe sepsis, recognize when your baby is having pain, and just to seek medical attention if it doesn't heal properly. The healing process is about 7 days. And then each and every doctor has his own way of doing it. It has its own technique. Some has a little ring and other has just a few stitches around, which and it's acceptable ones. And you can do it in your community at your community GP. I think in Cape Town we have that luxury where practically every GP does it. We've moved away from having it done at the imam. I can remember that as a child with my grandfather, and people used to bring their babies there, and people used to be. But
I don't remember that.
That was a long time. I'm going to give away my age. But I can remember that. And then you of course have your pediatricians and urologists that can do it. And sometimes people do it much later also in life. So some children are done later for medical reasons. Right, in conclusion, let's just quickly discuss immunizations and follow-up visits when they should be happening after baby leaves. The mom that post-delivery mom should come at day 3, day 5 and day 7, and then you have your 6 weeks postnatal checkup.
The 6-week follow-up,
and that is all checks for you and baby, not just to check on whether you are managing well, your vital signs, or whether you're not bleeding or whatever, but also your emotional status, which is very, very important. And then the immunizing starts at birth, which is the anti-TB vaccine that we give, that is the BCG. And then 6 weeks, 10 weeks, 14 weeks, that's 4 weeks apart. And then there's a little bit of a break, and we start the measles at 9 months. 18 months is measles again. And then the baby gets, the toddler gets at 6 years, and then again at 12 years for schooling. And then 6 months from birth, we get the vitamin A, which we also give to the baby.
So up until what age will baby go in?
We give
toddler is still much older.
About 2 years old.
Okay, great. This brings us to the end of this edition of Pregnancy to Parenting, newborn, focusing on newborn at the time of birth. All this bits and little odds and ends of information that we must know. It's important. Often we just Google it or get it from the neighbors or friends. But shukran so much once again, Sister Fawzia, for making time available to chat to us about this. And may the Almighty continue giving you the necessary strength and appreciation and definitely the patience to get through all the births that is still lined up in the future, inshallah.
Inshallah.
Yeah. Again,
I just have to say to my Aunt Shaida, I hope you're watching and drinking a cup of tea and having one head sohi.
Shukran, Sister Fawzia. Sister Fawzia, wa alaikum assalam wa rahmatullah. That was Sister Fawzia Samuels, head of the midwives at Al Nisa Maternity Home. Stay tuned for our next show as we follow up with our 6-week visit at our gynecologist and all that bits of information that you need to know around that. Hope you're enjoying your day wherever you are. Be safe, buckle up, and spend time and enjoy your kids during this festive season. From myself, wassalamu alaikum wa rahmatullahi wa barakatuh, and a very good day to you.